What's up, ~'𝐴 fam? This is Dr. Leah from ~𝗃 Chiropractic. Today we're going to be talking about low back pain that comes specifically from disc issues, okay? So I'm going to pick up this one and I'm going to orient you to it, okay? So this is a little piece of a lumbar spine, okay? This is actually the front of your spine, so all your organs are going to be in front of it. And right here on the back, these are your spinous processes. This is the little knobs that you'll feel if you run your fingers down your spine. Okay, so we see these on x-rays all the time, okay? When we're looking at a little portion of your lumbar spine on an x-ray, we want to see these vertebral bodies right here, nice and square, well lineated. These squishy guys here, they're actually your discs. You might have heard of that before, right? Discs are so important. Why? Well, we used to think it was a shock absorber, right? All the beatings that you put your spine through. You know what it actually is? A spacer. Okay, this disc holds space for these nerve roots to exit, which is important, right? Because these nerve roots come out, wrap around your body, and feed and supply everything in your whole body, right? So in this area, this is going to be supplying your gut, your genitourinary system. This is all going down into your legs, all the way down to your feet and toes, right? So this is what happens, right? If you have a subluxation, any misalignment on your spine that's affecting your nervous system, what it's doing is putting an abnormal amount of pressure on this disc, whether in one area or all the way around, okay? This long term is going to compromise this cartilaginous ring right here, nice and thick and strong. And what it's gonna do is it's gonna bulge out, okay? Including up to this nucleus here. It can bulge into any one of these canals. This is the main central nervous system canal. Here's your nerve roots, okay? Which means right off the bat, you're gonna lose function, okay? Your nervous system operates off chemicals and electricity, which means it's not gonna fire the same way. It's not gonna function the same way. And when it doesn't function the same way over time, it's gonna lead us to what we call symptoms, right? Body signals. Studies show that by the time you get to low back pain, you're kind of in the end. You're in the last 25% of subluxation. Really, the first thing that we see is dysfunction. Okay, and bear in mind that disc bulges, your body's taking care of all the time, okay? 80% of the population is walking around with disc bulges right now, okay? So let's talk about what a chiropractic adjustment actually does, okay? Let's pick a little bit more of a degenerated here, okay? Here's a little bit of more of, actually significantly more degenerated spine. Look at what's going on with this person's disc, okay? It's actually coming out into this nerve root area here, creating a ton of choking-like pressure on this nerve root, okay? So when you get a chiropractic adjustment, what it does is it actually helps mobilize this joint, draws attention from your nervous system. Your nervous system now, without that interference, after an adjustment, without that interference, is now free to draw inflammation away from the area, stabilize that joint, and start the healing process. Why do you want to go to a chiropractor first? Here's a stat everyone needs to know, okay? When you have low back pain and you start at a medical doctor, over 40% of people end up in back surgery. If you start with low back pain at a chiropractor, the stat is less than 2%. Okay? It's an extremely effective, conservative way to treat subluxation in your spine or disc issues. If you're suffering from low back pain and any of this resonated with you, you think you have some disc issues going on, come in and see us, okay? You need to have a full assessment, x-rays, and examination consultation to see what we can do to help you.